What are other errors, major errors? I can't believe it, I've already talked almost an hour. Okay. And also, if you have a question, just raise your hand. We'll talk about, if you do. Okay. Medication errors. Medication errors are a big problem. We have over 10,000 prescription drugs and over 300,000 over-the-counter drugs, supplements, and herbs, and about 5 to 10% of hospital patients have medication errors. This appears to be higher in doctor's offices. Again, there's no teamwork. Medication errors in one study cost the United States $21 billion per year. As you know, handwritten records by doctors are a big problem, maybe less of a problem than they used to be because states have started to pass laws that say medical records must be legible. Now, there's no penalty for not having a legible prescription, but if there's an accident afterwards and there wasn't a legible prescription, that could be evidence. Our prescription forms, and there still are handwritten prescription forms, are ridiculous. We know from bank checks, people should write it out twice, once with Arabic numerals, once in words, okay? When banks started to do that, errors went to zero. Is money more valuable than our health? I don't know. Okay, yes, probably in this country it may be. We're eliminating some of the confusing codes. And this is for example, AC before meals, PRN as needed, BID twice a day, QD every day, QID 4 times a day, QOD every other day, OD every day, PC after meals. I mean, who knows what those mean? And you get into a forest of things that cause errors. Nobody knows what they mean anymore. It's very, and you shouldn't take a prescription that has those old Latin and Greek and some French terms on it. It's passé, and the Joint Commission even says they shouldn't be used. Since we shouldn't use formulas in our prescriptions. Don't take a prescription with a formula in it because you might get MSO4, morphine sulfate, confused with, and that's a very serious drug, MgSO4, magnesium sulfate. So don't prescribe with formulas. Since the FDA will no longer provide look-alike and sound-alike drugs. They're called LASAs. Adderall, a stimulant for ADHD. Inderol, a beta blocker. You don't want to give somebody who needs a beta blocker for a heart condition Adderall. Okay, but it happens. It happens. Zyrtec, an antihistamine. Zyprexa, a powerful anti-schizophrenic, which can cause brain and movement disorders. Most large hospitals today have or should have computer provider order entry, CPOE. You want to make sure that yours does. If you're going to a hospital or somebody you know is, it generally reduces medication errors by about 85%. Again, this is a system that screens drug interactions, overdoses, things of that nature. This is something that is very, very important, and again, the money system of medicine seems to block it in most places. A great reform of early 20th century medicine was to allow nurses to make rounds with the doctors. seems natural today. The nurses are actually taking care of the patients. They know the patients. They can describe their symptoms. A very, very important reform is something called clinical pharmacy. Your hospital should have it. Clinical pharmacy means that the pharmacist actually goes on rounds with the doctors. And the pharmacists really know about these drugs and know about drug interactions, not just between and among drugs, but with your body type, with your gender, with your weight, with your age. And when we have clinical pharmacy, we then get over 40% reduction in overall medication errors and I think it's a 94% reduction in errors that cause fatal or very serious injuries. So 21st century medicine should include pharmacists rounding. A few hospitals have it, the minority. It stops a lot of errors, but most don't. Why? Money.